Hello, my name is Amanda Sims. I am a nurse practitioner student, and I want to talk to you about the pathophysiology of your new diagnosis of malaria. So, first things first, let's talk about how this happened. So, when you were traveling, what happened is you got bit by a mosquito. So, this parasite that you have is what's causing all of your symptoms. It travels on mosquitoes, and when the mosquito lands on your skin, it bites you, and then that parasite travels through your tissue, your skin, to your bloodstream. And then it also can migrate to your liver where it can stay there for a little while. Typically, your symptoms start to show up about 2 weeks after you're bit by the mosquito, which is probably what brought you here to us today. Some of those symptoms can be fever, chills, sweating, body aches. Some patients have headaches. A lot of patients experience nausea. Some are vomiting and have diarrhea. Some also get something called jaundice. That's when your skin and the whites of your eyes start to turn yellow. And some patients develop a cough, or they could have a fast heart rate, or their breathing could be really fast. A lot of patients report that they feel really tired or that they don't have any type of an appetite. So those are all symptoms that we would say are pretty mild to moderate malaria that we can treat with an oral medication that you just take every day. And usually that's very effective. Occasionally, some patients will progress to what we categorize as severe malaria. Those symptoms that we want you to be on the lookout for are any seizures. If you start to see or hear things that are not there, if you feel like you are confused, or if your family members are feeling like you're experiencing some confusion. And then also we need you to be watching for urine changes. So when you go to the bathroom, notice the color, and if you see any change in your urine, like for example, if it gets dark or bloody or anything like that, that would be something that you'd want to come back in for as soon as possible. In those instances, we will have you be admitted to the hospital and we'll treat you with IV therapy. Yours is only considered mild, which is awesome. We caught it soon enough before it progressed. So obviously we ran the blood test, and that's how we confirmed that that's what you had. So what we're going to do is we are going to prescribe a drug called chloroquine that we're going to have you take for a few days, and then we're going to have you come follow up with us after. So what will happen is this drug kills the parasite that's in your body, and then we will do a follow-up blood test in a few days, and as long as the drug worked effectively, then we won't find any more of that parasite in your body. It's usually very effective. The only thing that we'll tell you is if there is any evidence that you are starting to move into that severe malarial category. Those symptoms, again, are the confusion, seeing or hearing things that are not there, any seizures or any urine changes, anything like that. We want you to come right back in so that we can address those. Do you have any questions for me?